Eli Lilly's antibody treatment received FDA emergency use authorization just this week. ABC's Alex Perez talked with a doctor who's one of the first people receiving this new treatment in the country, right in southern Indiana.
A first look at the new treatment created specifically to attack a coronavirus, researchers taking the most powerful antibody from one of the first survivors and using it to create a synthetically made version to fight the virus.
The fever came on that I knew things were really beginning to look bad.
David Schulz is one of the first COVID patients in the country to receive Eli Lilly's new FDA-authorized antibody treatment, Bamlanivimad, at Clark Memorial Hospital in Jeffersonville, Indiana. Schulz, a doctor on the front lines treating COVID patients, tested positive a couple of days ago.
You just got your infusion. Describe how that was. What happened?
They hooked me up to an IV, and they gave me the 1-hour infusion of the monoclonal antibody. There were no side effects to it, and I'm assured that this is going to speed up my recovery.
You must begin treatment within 10 days of the first symptoms, and after receiving an infusion, patients go home to recover, freeing up valuable hospital space and staff.
This is a treatment that can keep them from becoming sick enough to be in the hospital. So it keeps them out of the healthcare system.
But only certain patients are eligible, must be 12 years or older with mild to moderate symptoms and likely to develop severe illness, including many with pre-existing conditions like diabetes and obesity. It's not for people already in the hospital. Availability is limited. 88,000 doses ready now, 212,000 more expected by the end of the year.
Is this the bridge that we needed until we get that widely available vaccine?
This has given us hope. It's given us that ray of sunshine to say we have something that will help patients from getting sicker.
And from this new treatment for those who have it to the vaccines meant to prevent it. Pfizer says early data shows its vaccine could be 90% effective and may apply for emergency authorization as soon as next week. And Moderna not far behind with their vaccine, saying they could be ready to apply by next month.
And doctors across the country are learning more about this new treatment right now, along with the rest of us. If you believe you're a candidate for the new treatment, you should contact your doctor or medical provider. Alex Perez, ABC News, Chicago.